Welcome to this training for public service for individuals with intellectual and developmental disabilities. Modes of communication. There are many modes of communication that people use to get their ideas across and their needs met. The most common of these are verbal, nonverbal, written, and visual. Being nonverbal only means an individual does not rely on speech to communicate. It is not indicative of cognitive functioning. As you engage with the IDD community, it's possible you will encounter some unique types of communication. It's important to value and validate all forms of communication. With all modes of communication, it's important for you to communicate directly with the individual rather than with a caregiver or bystander. However, it is appropriate to ask a caregiver how to best communicate with the individual. Communication types used by people who do not rely on speech are called AAC, or augmentative and alternative communication. It's important to note that a person who uses an AAC may also speak and not use support exclusively, just as a person who uses a wheelchair may not be bound to the chair. AAC is a support that allows an individual to maximize their independence. AAC is truly multimodal, permitting individuals to use every mode possible to communicate. AAC incorporates the individual's full communication abilities and may include any existing speech or vocalizations, gestures, manual signs, and aided communication. AAC can be divided into two types: unaided and aided modes of communication. Unaided modes of communication include non-spoken means of natural communication, including gestures and facial expressions, as well as manual signs and American Sign Language, or ASL. These modes of communication often require adequate motor control and communication partners who can interpret the intended message. Aided modes of communication include those approaches that require some form of external support, such as communication boards with symbols, or computers, handheld devices, or tablet devices with symbols that generate speech through synthetically produced or recorded natural, digitized means. In a high stress situation, it's likely those who typically rely on aided modes of communication will not have immediate access to their supports, so it's important to understand and value both types. Unaided modes of communication require the communication partner, us, to be observant and responsive to gestures, facial expressions, as well as agreeable to physical touch at times. When gesturing fails, a person may physically push, pull, or move their communication partner to convey their message. This action is often called hand over hand and can feel invasive. At the first notice of use of sign language style gesturing, it's important to explore alternative aided communication options such as writing. Aided modes of communication require an external support to assist with communication. These supports can be as simple as writing or as complex as speech generating devices. Allowing an individual's access to aided modes of communication will decrease anxiety and maximize the sharing of information. Once an aided mode of communication is being utilized, it's important to allow the person a significant amount of time to process your question and respond. Types of communication and ways to use them. Verbal. Use a strong, confident speaking voice. Use active listening. Avoid filler words. Avoid industry jargon when appropriate. Nonverbal. Notice how emotions feel physically. Be intentional about your nonverbal communication. Mimic nonverbal communication you find effective. Visual. Ask others before including visuals. Consider your audience. Only use visuals if they add value. Make them clear and easy to understand. Written. Strive for simplicity. Don't rely on tone. Take time to review your written communication. Keep a file of writing you find effective or enjoyable. Scan this QR code to get additional resources. Thank you.